Hey everyone, this is Logan. I wanted to make a quick announcement before I started in my regular video, because I'm actually going to use the beginning of this video for my GoFundMe. I have scheduled top surgery as of yesterday, and I'm super excited. I'll go into all the details after this, but basically, I'm going to be going to a doctor outside Detroit. And it'll be April 15th. So I have 2 months to raise some money. I've already paid for it, but I'm going to be off work for 6 weeks and obviously need just help paying for those expenses. So I'm going to start a fundraiser account, also have a couple side hustles coming up. But yeah, so let's get started. All right, so the last video I made, it was last month, and it was regarding the crazy stuff I had going on with my health back whenever I had to be hospitalized. So I think last time I was just going off T temporarily to start on shots. So I took the 2 weeks off my Axiron, which I miss so much, um, and then got on shots. Okay, so I've done 6 shots at this point. I have 6 months on my T shots, and after 5 weeks, I got to go back for my checkup, just to do my labs again. So she had me on a half dose of testosterone with the shots, just so I could ease my way back into it since everything was kind of not going so well. And in that time, I felt terrible, and I'm just now starting to recover. It's something I struggled with actually a couple years ago when we dropped my dose to like a weirdly low level. I have such mental health issues when that happens. I can't even describe what happens. It's always when my T is higher than what a cis female typically has and lower than what a cis male would have. So when I just went back for my checkup, my everything thankfully looked good on my labs, so I did get to increase this last week to regular dose, which I haven't had since near when I started T. But my T level was at like 158, which is crazy low to be like on T. It should be between like 350 and 1,000 is pretty much like anywhere in there, but 150 is just like no wonder. So when I went to the doctor, I talked about tons of things I had going on. Obviously, I was anxious if my labs didn't come back okay with my hemoglobin hematocrit. We were gonna have to talk about just other routes that we were gonna take. My blood pressure obviously needed to be stable, and yeah, so talk to her about everything. Um, my anxiety was off the chain, like terrible. Um, Literally, I was having panic attacks constantly, like on the way to work. Kept having to call off work, not only for my health, for my blood pressure, but also I like couldn't breathe. And I've never experienced things like that except before when I had my T levels were low. So it just like really messes with your head. It's like not. I hate being in that place. I didn't think I was gonna make it. Your body is like literally going through a withdrawal from T, and so that low dose that I've had for the last few weeks, it's slowly like creeping up that it's getting better, but it hasn't been good. This last week is the first week that I got to have a full dose, which is for me, it is 50 instead of 25, which I was on. So I got to double it this past week, and I'm definitely feeling it. Um, but I do my shot every Sunday. At first, I was doing it on Mondays, but it was causing too much anxiety. I was doing it Monday evenings, And so all day Monday at work, I would be like freaking out about the shot. Much easier. I do it on Sundays now, generally like Sunday mornings. And for anyone who wants to know, the shot, I do it into my stomach, and the shot you do not feel it. Like, honestly, sometimes I feel a little prick, sometimes, but generally I don't feel anything. But I have such anxiety regarding needles. One time, my second or third shot, I passed out, like, because I'm just such a wimp. Um, it's really hard to stick yourself if you have struggled with like needles your whole life, and I have like a few like pretty major phobias, and needles is bad, and I can't even begin to think if I had to throw like veins in on that. So just the needles is too much. But it's getting better. I bought a shot blocker for kids, which is like a device that has like ribs all over it, kind of like these little dots, and you can push it against your skin, and it kind of tricks your brain of where the stick's coming. It's definitely like a mental thing for me. I don't feel the stick in the first place. I have like lots of fat on my stomach. There shouldn't be an issue, but it's just getting over that barrier of wanting to do it. I've done my shot to myself every time because for me that's easier. But there was 1 week, 2 weeks ago, I think, that I thought Aaron was going to have to do it because I was like hyperventilating. Um, yeah, it's really embarrassing. I'm hoping that I get over it with time. Uh, like, honestly, this past week was good. Like, I feel like as I'm having less anxiety because my hormones are getting more level, like I'm having less trouble giving my shot. So hopefully everything goes back. Yeah. She did prescribe me Lexapro for my anxiety that I was having because it was so like it felt so terrible. But then I got my lab results back and I saw how low my T was, and so I was like, I sent her a message and was like, do you mind if I hold off on taking the Lexapro because I think that my anxiety is generally induced by a low T? And she was like, oh, sure. So I have those filled if I want to start taking them, but more than likely, if I get back in the mental state that I was before, which was like just perfect, with my T being at a normal range and everything, I probably won't need to take it. But if I get to that point again where I'm like, it's really debilitating and having panic attacks constantly, I'm gonna start it. My blood pressure medicine, she kept it the same. She said my blood pressure looked good, although when I check it at home and when I was just at the dentist when they checked it, it was high. Um, they use I use a like electronic cuff, and they don't at my doctor, so I don't know which. I talked to her about it. She said it should be good with this new medicine. As for oh yeah, when I went back for my checkup, she talked to me again about top surgery because I've been trying to figure out what I want to do, and I had reached out to Dr. Doolin in Dallas, did a email consult, and was waiting for the pricing. And then I had done some more research, and I was looking on Facebook, different. I'm in several top surgery groups and things, and I went ahead and went back to researching Dr. Wolf in Michigan, and I have loved his results. Since ever I found out about him, but for some reason kind of had written him off because of the drains. He uses a different kind of drain, which is supposedly much better, as far as your comfort. You have them in longer, but they're the Penrose drains, so they like stick out just like an inch, and they're silicone, and you don't have to strip them. Whereas Dr. Doolin in Texas, you don't have any drains. But the cost is like $2,000 different, and I'm paying out of pocket, as I've said before, because I have an exclusion in my insurance. So I sent Dr. Wolf a message at the same time I sent Dr. Doolin, and his office got back to me much faster. And I was like, you know what? I would rather get this done sooner than later. Whatever, long story short, he did a email consult with me as well, quoted me at $5,900, including everything except prescriptions, which is phenomenal. And I called yesterday to schedule, paid the $500 deposit, and then you have until 2 weeks before your surgery, which is your pre-op date, to pay for your surgery. It needs to be paid in full at that date. And so I have the cash in my account from a loan that I took to move back to Ohio. So it wouldn't matter either way if I waited or not. It's going to be the same money. So I went ahead and called back today to pay for the rest in full, just to get that out of the way. I'm super excited about it. I will be going up on the 14th. Yeah, I'll be going up on the 14th, a day before. I'm going to be staying in an Airbnb, which I haven't booked yet because I'm a couple months out. And going to be staying there all week until that Saturday. And so on that Saturday will be like the reveal and post-op number one. And the rest of the follow-ups can be done digitally. So that's really nice that I don't have to drive back up to Detroit, which was going to be the same thing with Dr. Doolin as well. So for me, it came down to the pricing and the timeline of when I could get it done. And this, honestly, um, the timing wise will be pretty good. So I'll be able to recover at home and everything like that. I'm super excited. I'm going to be, like I said, trying to raise some money and get everything all in order of what I need to do before I go, because it's like 1 week up there, 2 weeks you're kind of like feeling shitty and in pain, and like up to 6 weeks you're like in recovery with everything. And you can start doing like physical activity and stuff after that. So just wanted to give an update that things were much better when I switched to the shots. Feel free to comment or send me a message about any questions you have regarding my the medical stuff of my dosage, my labs, and things like that, because I've been having a lot of issues with it. I go back for a follow up in a month. Yeah, thanks for listening.